Hello, everyone, and welcome to CIBC's webinar for charities and not-for-profit organizations. My name is Steve Kuahara. I'm the team leader for CIBC's public sector and not-for-profit group. And on behalf of CIBC, I'd like to thank you for joining our session today. This is the fourth webcast that we've held since March. And today we're going to be discussing the impact that COVID-19 is having on the not-for-profit sector and the actions that organizations are taking in light of the pandemic. So we're delighted that you're able to join us for this session. I believe we have attendees from BC to Atlantic, Canada, and everywhere in between. So welcome, everyone. It's great to see such broad participation. Now, we have three very experienced leaders from the not-for-profit sector as our guest speakers today. From Canadian Cancer Society, Andrea Thoughts, CEO. From Children's Aid Foundation of Canada, Valerie McMurtry, President and CEO. And from William Osler Health System Foundation, Ken Mayhew, President and CEO. And Ken is also the incoming chair of AFP Canada. So all three of these leaders have a tremendous amount of experience in the not-for-profit sector, and they've all worked with organizations that have national scope. So we're going to hear their thoughts and their ideas in a roundtable panel discussion format. We're also going to have a question and answer session with our audience a bit later on. So if you have any questions or any particular issues that you'd like our speakers to address, we'd encourage you to ask questions by clicking the icon at the top of your screen. So let's get started. Welcome, Andrea, Valerie, and Ken. Thank you very much for joining us today. I guess if we could start with a fairly broad set of questions, namely, how has COVID-19 impacted your organizations, including your revenues? And secondly, what actions have you taken in light of the pandemic? And that could be either short-term and tactical in nature or more permanent and strategic in nature. So Valerie, why don't we start with you, and including a brief overview of your organization, if you could.
Well, thanks very much, Steve, for the invitation to speak to you today about how COVID-19 is impacting our work. I'm really honored to be on the panel today with my esteemed colleagues, Ken and Andrea. And I'm definitely pleased to share a few stories about what's been going on in our shop. But I wanted to also start by saying that while our foundation's been really busy adapting, like all of us, to the changing landscape in the community and the charitable sector in particular, we definitely don't have it all figured out. I hope we have time today for some Q&A and some discussion so that we can all learn from each other. For those of you who may not be that familiar with our foundation, we are a national organization. Our core business is fundraising, but we raise money and grant and develop programs to support children and families who are involved in our child welfare system. And we cover the gamut from prevention work to where we're hoping we can strengthen families and reduce the number of children who come into the foster care system in the first place. To the other end of our system, we're also very concerned and spend a lot of time and effort on the very vulnerable population of young people who age out at the age of 18 out of government care. So that's our broad landscape. We are not, I always like to mention this for people who get a little bit confused by our name, we are not a government agency. We do not receive funding from the government. The work of the Children's Aid Societies, the protection work for children is done provincially across Canada. And that's not our core business. With respect to how COVID's impacting our work, I focused really my comments in three key areas. Like everyone, when we think of our operations, like everyone in the matter of a day, our business operations changed. And I think at this point, probably for good, back on March 17th, when we relocated to work remotely from our office. The beginning of the pandemic coincided with our year end, our March 31st year end. So in a way, it was kind of helpful timing from a planning perspective. Our board asked us immediately to look in on our 2021 business plan and to reflect, and they gave us time to think about what the COVID impact on our revenues would be. So we presented by the end of April, we went to a board meeting and presented a really conservative budget. It included a very significantly fair. And in that revised budget, we reduced it to 0 at the time, knowing that we would very likely, we're kind of in our worst case scenario planning at that point, but knew that we would very likely, and in fact, have canceled the gala. That was a really tough pill to swallow because it is our biggest source of those precious unrestricted dollars. The rest of our operational plan, I was just so pleasantly surprised and proud of our team about how quickly we were able to adjust with our new set of tools to working remotely. We were accommodating all the technology requirements and so on. And I think we also really felt with empathy the flexibility that we needed to provide for the lives of our staff and our colleagues. Our team's not that big. We're just around 33 people. But, we had to give some care to that. In terms of the impact on our programs, COVID-19 has had an immediate and dramatic impact on our children and families involved in Canada's child welfare system. Already amongst, I think you could argue, the most marginalized and at-risk population in society. These are families who struggle in the best of times with issues of poverty and social isolation, complex trauma and mental health issues. In particular, as we were hearing firsthand from youth who've aged out of government care about their escalating issues and crises, we knew that we needed, and we were in a very good position to do something. We needed to act. And while we're not typically a frontline service, we're a foundation, we're not typically in the business of frontline agency work. We did, because of our national scholarship program and also a program we run in partnership with TELUS, a phone program. These two programs alone actually put us in touch directly with over 6,000 aged out youth across Canada. So we looked at our process for how we were running those programs, and we reflected on the fact that we could, in fact, get into a direct delivery role in the form of providing emergency financial grants to youth who applied. Of course, it sounded like a great idea. We didn't have funding specifically for that. So both sides of the organization got busy. We went out and started aggregating funds, thinking about who we could ask to support this emergency COVID response program. And then internally, we had to completely overhaul our banking system to provide direct EFTs to youth. So the finance team in our office were really busy on that. Our grants and programs team got really absorbed in building an online portal and application process so that we would administer this program. So that kept us really, really busy. April 1st, I think it was, we opened our portal for online applications. We'd set a fundraising target for ourselves of $5 million. And we certainly didn't have that raised by April 1. We had less than $1 million, maybe 600,000 ready for distribution. So we went ahead, we said, listen, this is a crisis. And the government had not started rolling any of its programs yet. So we just jumped in. And in that first less than 48 hours actually later, after we opened the portal, we had over 2,000 applications from youth from all over the country, hoping that we could help them with some emergency funding. So that, of course, was like a tsunami for our little foundation. So we had to put it on hold, the application portal. We didn't want to set up false hope for all these young people that we were going to be able to respond to all of their needs. And we put that on hold and started until we could catch up with our fundraising and our administration. So it was kind of adrenaline kept us rolling on those first few weeks. And we got firsthand, we just got to see the incredible acts of philanthropy and the generosity of longtime donors to our foundation who really doubled down their efforts. We received a really significant gift from the Rogers family up front. Our corporate partners came through. We have great relationships with many private foundations who are digging deeper into their own reserves. And we also set up a community portal, a community fundraising initiative. And then a new source for us actually was we received our first ever provincial grant, matching a really helpful 1.5 million from the province to use in our fundraising program to get matching dollars going. So really a frenzy of fundraising, and then an ability on our grants team to start delivering that funding. It was a big learning process for us on that end. So I use that as an example of something good that we were able to do, very responsive to the urgency that COVID was creating for our population. In terms of sustaining that, we've moved past that first phase of things, and we are continuing to fundraise and grant to our community partners now. We kind of had a chance to reflect on the best way to do that over the summer. And we've raised over $10 million now just for COVID relief funding. And we've over the summer opened up an expression of interest in a process where we work, as we do with most of our programs, through our traditional channels with agency partners across the country who are now receiving that funding. In terms of the fundraising, that story in and of itself reflects the base of the strength in our organization. We're fortunate because we have strong relationships with major and corporate donors, major gift donors and corporates. Many of them are in multi-year commitments to us, and they fund national programs, other programs besides this COVID relief piece. So from a fundraising perspective, we had some reliable revenue coming in. And now, ironically, like quite by surprise, we're having our record fundraising year, our biggest ever in our history. And yet, here's the thing, and I'm sure this will resonate for many people listening in today, we're struggling with our ability to raise unrestricted dollars. And that has us really worrying about our operating budget and sustaining ourselves for the future. Events have been the single biggest driver of unrestricted money. The gala I mentioned earlier. We've tried to mitigate our losses just in terms of things we've done, and I'm really interested to hear what others are doing. We launched what we're calling the Ungala, and that, of course, is going out to our longtime sponsors and ticket buyers and table buyers and so on to ask them for support in our really difficult year of COVID-19. So we've got, I think that that was my timer that went off a minute ago. So
Sure.
I think
Okay.
I'm going to turn it back to you, Steve, and I'm happy to come back to a few of these items around our fundraising program, if that's the area.
Okay. Great. Thank you very much, Valerie. That's actually a good segue, I think, to perhaps to Andrea. So, Andrea, I think it's been less than 3 weeks since the Run for the Cure, one of your major fundraising events. Obviously, you had to hold it in a different way than in previous years. So how has Canadian Cancer Society been impacted by COVID, and what actions have you taken to respond? And again, perhaps you could give a brief overview of your organization. Oh, it looks like maybe we lost Andrea. On that note, Ken, why don't we go to you? So, Ken, you're wearing a couple of different hats. One is the chair of a major CEO of a major hospital foundation, and also as the incoming chair of AFP Canada. What are you saying? And perhaps a brief overview of your organization.
Sure. Thank you, Steve. And appreciate CIBC's continued support for the nonprofit sector by doing things like this, and also supporting AFP means a lot. Visible leadership is critically important right now. Yeah, we at William Osler are a series of community hospitals in the northwest part of Toronto. So we serve communities where we have a huge portion of people who are visible minorities, people who are new Canadians, fairly modest socioeconomics generally. And I was trying to figure out how to express this simply, Steve. So I am both the hospital foundation president and CEO, and a member of the executive team of the hospital. So that means that there are 8,000 physicians, staff, and volunteers at Osler. And I work out of Ontario's very first integrated health and wellness center, Peel Memorial Integrated Center. Except now I work out of Ontario's first COVID, cold, and flu center. So it's completely been reimagined for the purposes of handling the most tests conducted anywhere in the province. We're incredibly busy hot zone for COVID. We're caring for people, as Valerie said, who are often vulnerable. We have lots of people who have to go to work, who take public transit to go to work, who have multiple generations in the same household. So we're very much impacted, I guess, literally and physically by COVID as such. On the fundraising side, we're on the front lines. So we had the community step forward as never before. And I think it's really important that we acknowledge that that won't be the case for everybody on the call. In fact, it won't be the case for many on the call. And I'll get to that in a minute. But specifically, we were fortunate because the chair of our board is in manufacturing, and he had, told us that the time to retool was before you need to retool. And we had issues going on already with realizing that some of the signature properties had been around for a while, and there was a lot of events in the market space, and perhaps some of the attendance, wasn't necessarily as robust as it had been in the past. So we'd invested pretty heavily in digital and in marketing and in brand presence, so that when it actually hit, we were able to, I guess, as easy as anybody else, pivot and transition to that, Steve. We received 350,000 donations of, gloves, 300,000 masks, 18,000 meals. We had people literally on our doorstep every single day. In terms of specific tactics, we had, I think, 360% increase in giving. 46% of those donations came from people who were first-time givers. And we achieved our digital strategy in terms of raising more funds online in 2 months than we had in the previous 3 years. So we were fortunate enough to be on the front line, literally and physically, but also we had the capacity as an entity to be able to handle that. And as Valerie said, not perfectly. There were lots of late nights and lots of blips, the odd time our website went down, but by and large, I think we were able to handle it reasonably well. From a tactic perspective, things that might be helpful for others, we found things like challenge matches to be really, really valuable. We found that people were willing to step forward and challenge others to do their part, and we were able to multiply challenge gifts many, many times. So that worked really well for us. Similar, again, to Valerie, we had a few community leaders who stepped forward, be they companies or individuals, and they matched other people to do their part as well. And through that, we were able to have quite a good multiplier effect. We have very strong branding, so we were very prominent in the marketplace to begin with. And that's a double-edged sword, Steve. So on the one hand, it enabled us to raise a lot of funds. But on the other hand, and this is very important, I think, in community fundraising, in a good year, we raise as much money as every other cause combined. And this isn't our crisis, right? It's everybody's crisis. So there's no one entity that I think is more deserving of any others. So we made sure that we were very thoughtful in our approach. And we, for example, held food drives in the hospital for local food banks. We did clothing drives. We encouraged people to donate PPE elsewhere, not to us, but to long-term care homes. And just so, we were able to convey a sense of that we're all in this together. And I think that hopefully will help us pivot out of this. Like Valerie, our signature events were gone. So in the stroke of 5 minutes, a gala that raised $2.2 million last year was zero, had to be completely reimagined. So we're still going through lots of those things. We're pivoting. We've had a couple of third-party South Asian telethons that have come from nowhere for us, right? So you mitigate and you make up funds when and however you can, but we certainly will be, I agree with Valerie as well. I think it's permanent. I don't see us going back to the way we used to fundraise before. So maybe a couple other final thoughts on that. I think there may be benefit in this because some nonprofits had become very dependent on 2 or 3 mega gifts a year to make their year. You sort of, if you're a major gift shop, you can become quite dependent on that. And this is requiring us to do the harder work of community engagement, volunteer mobilization, working with and through others, with some of the patience and literally the financial investment required to do that, right? Some of those annual programs. So that gets into the cost of fundraising. It also requires us to deal with the gravitational pull of how things have always been done. And I suspect Andrea can relate to the community ownership and pride that comes with the way that it's always been done. And as we're seeking to mitigate and pivot and imagine our next, we just have to make sure that we do it with and through others and not by ourselves, because otherwise we could find, leading with no followers. So that's another thing that we're really thinking about as we imagine the culture change involved in moving to the next. And that would be our story.
Well, that's great, Ken. Thank you very much. So, Andrea, I think we lost connection with you there for a few minutes, but it looks like you're back. Can you hear us okay?
Yes, I can. Oh my
Okay,
goodness. Yes, I'm
that's
back.
great. So listen, we were just saying that it's been, I guess, a little under 3 weeks since your run for the Cure, one of your marquee fundraising events, which has kind of been a topic of conversation. I understand it was very successful, but you had to do it in a very different way this year. So maybe you could comment from Canadian Cancer Society's perspective about the impact of COVID-19 and the activities that you're taking in response.
Sure, absolutely. Thank you, and thank you for having me here. For those who aren't familiar with the Canadian Cancer Society, we're the only national charity that supports Canadians with cancer from coast to coast, all cancers, all communities, and we do this through funding cancer research and also providing an extensive support system for patients and families, and also by advocating for better public health policies. And underpinning all of this is fundraising, and none of it happens without donors and volunteers. So prior to COVID, we're a large organization. We had almost 1,000 staff. We have offices in 68 different places in the country, and more than 100,000 volunteers working with us. And I'll let you know what our scale is now post-COVID, because definitely COVID has impacted every part of what we're doing. Now that we're 6 months in, I can say that I see the silver linings, the positive ways that this is transforming us for the future. But it's most definitely been a really difficult few months in the last little while, as it has been for everybody here. For the people that we serve, I would say COVID has really had a great impact on people with cancer, and people facing all kinds of different challenges have I think experienced the same thing, of just higher levels of anxiety and stress of how do you navigate the changes in the healthcare system. Of course, people are still living with cancer; they're being diagnosed with cancer every day, and they still need our healthcare system. But we know from patient surveys that we've done that more than half of people with cancer have faced some sort of interruption or change in their care. And in a lot of cases, because they're more isolated than they were before, people's caregivers are facing really extreme levels of stress. People rely on those networks of friends and family, and those have shrunk as people have tried to respect social distancing and bubbles. So in terms of the service changes that we've made, we've really tried to focus on the services that can be delivered in this virtual environment that we're mostly living in a lot of ways. So our helpline, which is a toll-free phone line, and our online community called cancerconnection.ca have been really valuable, really, really helpful to people during COVID. And we've tried to add more capacity to those so we can make sure we're meeting people's demands, and also really just letting people know that we're still here, and that we don't want them to be facing cancer alone. We also launched an COVID-19 emergency fund to specifically fundraise for COVID-related activities that we were doing, like PPE for our lodges, and the extra costs that come with that. A new vaccine trial that we're supporting to help reduce the symptoms of COVID in people with cancer. And in addition to how it's affected the people that we serve, we've adapted all of our fundraising and operations. This is the biggest financial challenge that we've ever faced, and since 1938. And that's, I think, because by far our we're a very event-oriented organization. As Ken mentioned, we have a grassroots nature that has meant that there's lots of events, there's lots of people doing things in their communities. About 35% of our revenue comes from events. So that's about $70 million a year that has been impacted by COVID. All those events have been canceled. Hundreds of events have been canceled. And another 20% of our donations come from corporate giving and major donors. And I think it's a little bit harder to say what the long-term impact is going to be there. We have been really pleased to see that is steady, but you could imagine that depending on how long this lasts and how the economy goes, that's something that could change. At the beginning of the pandemic, we were really unsure about how will things like mass marketing, direct mail, email campaigns, how will they do? And we've been happy to see that those have really held, and people are still giving in the ways that we would have hoped to from that. But overall, we've been preparing for a 40% drop in revenue, so a very significant adjustment to be needed. In terms of some of the actions that we've taken, from a fundraising point of view, we really very quickly just kind of redid our plans for the year and focused on trying to replace that lost revenue. We restructured our fundraising teams so that we'd be able to make decisions faster and be just as agile as possible. We eliminated quite a number of event roles and support positions. We figured out which events could go online, of which the CIBC Run for the Cure, the biggest breast cancer fundraising event in the country, was absolutely one that we knew had to be transitioned online, and learned a lot in the course of doing that about how to engage people, how to keep the relationship strong at a distance. And I'm really pleased that we feel that was a big success, generating more than $8.6 million for breast cancer research and support. Another key to our fundraising change was that we actually established what we call a supporter engagement team. So this was fundraisers who were doing a variety of different kinds of work in the past, came together as a team with a real focus to their priority was just connecting with people. So whether that's phone, whether it's email, a really big priority to us has been to stay connected with people. And where we might have counted on seeing you at an event or, something in the community, we knew that you'd have to proactively now this year, keep those relationships strong, let people know what we're doing and that we still need them. So that team has been really crucial, I think, to how we've adjusted. And there's been many other actions taken across the organization. We've unfortunately had to lay off about a third of our staff this year. We've also looked at all of our administrative costs and identifying places that we could reduce there. So our office footprint is reducing significantly. We've had all of our senior management team. We've reduced the size of the senior management team and had people take salary rollbacks. We've got everyone working from home and have made a lot of effort to make that workable for people. And I would say another change has been that we've been doing a lot of additional communication with our teams internally, just trying to understand how people are doing. Are they able to work the same way? What do they need in order to stay healthy? It's obviously taken a big toll on people mentally this year. So we've been trying to do more regular town halls, using more tools to ensure that we understand how people are doing and can provide support to them. And our staff teams, like probably Ken and Valerie have also mentioned, our staff have been amazing this year just for how fast everybody has worked and so creative and in spite of all the challenges. So I think many of these changes for us are going to be permanent because many of them are directions we've wanted to move. We'll want to be back in communities when we can be with events, but we also want to be best in class when it comes to digital engagement with supporters. And this has really pushed us further in that regard over the last few months.
Great. Thank you very much, Andrea. So why don't we turn to our second broad set of questions, and that really revolves around the longer-term impact of COVID-19. So again, questions for our panelists. What do you see as the biggest challenges and opportunities for your specific organizations and then for the not-for-profit sector as a whole? And again, what steps are you taking to address those challenges and opportunities? So Ken, maybe we could start with your thoughts.
Sure, I'd be glad to. Thank you, Steve. So I'm going to come at this from two contexts. First, in terms of us at Osler, but then also a little bit on behalf of the Association of Fundraising Professionals, 3,500 people from coast to coast to coast, every single sub-segment within the nonprofit sector, and sort of what they're seeing and what they're talking about when we are speaking to federal and provincial governments about the sector. And I think I'm going to start there because I think that the huge investments governments have had to make and will continue to have to make will mean that there'll be less funds to go around, right? So that organizations are going to need to develop revenue streams if they want to remain relevant or even viable. And if the public didn't appreciate the importance of some of those programs before, I think they certainly do now. So, I'm calling nonprofit employees essential workers, and we work in healthcare, so I understand essential workers have a certain dramatic connotation, but I think it's very accurate. And I think it's very important that we recognize that in order for the causes that matter to do what they need to do, they have to be able to generate the funds. And as both of my esteemed colleagues have mentioned, that's kind of easier said than done, and it's needed now more than ever before. So I think it's an interesting balance, Steve, between being strategic and being fiscally responsible, and then realizing that continued investment is required. It simply is going to be required. We will not be able to save our way out of this. And in fact, we are in discussions right now with CRA, and the discussions are going very well on their changing their guidance around cost of fundraising recommendations, simply because they know organizations are going to need to have to invest to do what they need to do, and responsibly and transparently and ethically. But that's going to be something that I think is really important. Certainly within the Osler Foundation, we're thinking, and we've gone to our finance committees and our board of directors and told them that we think this is not a time to cut back further than we need to, and we've had to a certain extent, but there actually is some opportunity within this. And we need to do it responsibly, and we need to do it, as I said, appropriately and strategically. But we will anticipate next year is going to be a tough year again, but we're not going to pull back too far because we're not sure how we would then regain relevance and entry place into the market space. So we're redeploying how we're investing, but we're still investing. One of the things that we're doing specifically around that has to do with branding and being digitally present and being relevant, and not being tone deaf, but also being memorable. And Andrea, I saw the beautiful PSA you guys did for the run, and the award that you received for that work. Like it's appropriate. It's not overdone, but it's memorable. And so we think that's going to be very important as we continue to differentiate in the marketplace going forward. I think our events are probably on hold for a while. So we're going to have to figure out, as Valerie did with, her reimagining her signature flagship event of the year. We're doing the same thing in a few weeks' time, because we also think it's important to maintain our brand reputation and our presence. So we have, there's a certain expectation relative to the brand. So we were fortunate enough to have a sponsor come in and cover all expense relative to a virtual event. And we'll have Sarah McLachlan give a tribute concert to thank our healthcare heroes. So it's totally reimagined, right? We won't have some of the usual stuff. Yesterday, I got to stand in front of an empty auditorium and be filmed giving my opening remarks to a crowd that wasn't there. But we'll still do a great job of mobilizing the community and thanking those people who are leaving their families behind every single day for the last 8 months to put themselves, in harm's way so that we can be safe. So it's a pivot. It might be more of an engagement strategy, I guess, Steve, than some, the traditional hardcore silent auction type activity. But I think that that's going to be more of the norm in the future. I think we have to be speaking to people's listening. I think, as a couple of people have mentioned right now, it's a challenging time. It is, people are tired, and they have Zoomitis, right? So they're a little tired of information. This, of course, being an exception, but it's kind of difficult to penetrate right into people with messaging right now. So we're trying to be really, I think, pretty careful about that. And the last thing I think is that just as fear is a contagion, so hope is a contagion. And I think that people are stepping forward, as both of my esteemed colleagues have mentioned, as never before, because we are a nation of people who help our neighbors and who are desperate to get out of binge watching and actually do something to help other people. And because that can't be done literally, physically, doesn't mean that it can't be done. And those entities that find a way to mobilize that, both on the nonprofit and the for-profit side, I think will continue to see momentum. Because in a time when there may be a sense of loss, providing meaning is hugely important. And both of my colleagues' organizations and mine as well provide that meaning. And that's part of what I see as the future.
Okay, thank you very much, Ken. Just a reminder to our audience, if you have any questions that you'd like our panelists to consider, please click the icon at the top of your screen and ask the question there, and we will try and allocate some time for questions and answers. But in the meantime, why don't we continue? Andrea, your thoughts in terms of challenges and opportunities facing the sector?
Sure. Well, yeah, I echo everything that Ken identified. I think one of the hardest things that we face is the uncertainty of how long will this last? How is it going to continue to evolve? And so that ability to stay nimble, stay present, be ready to adjust, I think is as a sector, we've always had this, but I think we're under even greater pressure to do that. And I think part of how we do that, and this is one of our challenges, I think, at this moment too, is how to take care of the people that are the people of the sector. It's very easy to see how people are getting close to burnout, and so pacing ourselves and taking care of our people, I think, is very important. Recognizing that everyone's under pressure at work, and then everyone is also under pressure at home. So being very mindful of that, I think, is going to be crucial, because you need that energy if you want to take advantage of the opportunities right now. So the digital transformations that are happening, I think, are really huge opportunities for our sector. I think for most of us, it's always a place where you need to be investing more, and yet there's always 20 other things that are also crucial. But this crisis has, I think, pushed all of us to put digital transformation to the top of the list of requirements. It's not nice to haves, it's absolute must haves, and that's both the platforms and the tools, but it's also the skills and the people who can do this kind of work, which is not easy to find in the nonprofit sector. So I think those are huge opportunities. I think these are also opportunities for people who want to make a contribution to the nonprofit sector to bring those to the sector in new ways. And then for all of us to see, like, where are those opportunities? There's certainly a lot of fundraising opportunities there, but there's also program delivery opportunities and ways that we can serve people differently than we have before, these are more transformations that I think we're going to see over the coming months. So those are a few of the opportunities that I would see.
Great, thanks, Andrea. Valerie. Oh, I think you're on mute, Valerie.
I got the memo to go on mute and then I forgot. When I think about our foundation and our number one most urgent issue, it's what I've already mentioned: our ability to generate unrestricted revenue. Things that have already been said by my colleagues, also true to us. COVID has exposed our strengths as an organization, but also definitely uncovered some weaknesses. And we are underinvested in our technology, I would say. We don't have a big base to market to in the first place. And so we have work to do to think about web-enabled communication and how to do that more effectively. That's sort of specific to our fundraising challenges. When I think more broadly about our sector, my sector, the child welfare sector, we know that families are definitely struggling, but I also see opportunity, and I think about things we've been involved in since the beginning of COVID around policy and advocacy. And I'll just say briefly about child welfare. One of the alarming things about our sector is that we know that incidents of domestic violence have been rising during this crisis, and yet call volumes to the children's aid societies and the child welfare agencies call volumes are actually down. And that's been primarily because children have been out of school and out of daycare and out of community programs, and they are our top sources for people reporting concerns about the safety of children in their community. So these are really frightening issues when we think about what may be going on behind closed doors. But in terms of things that the agencies and the sector are doing, I see a lot of cross-sector collaboration. I see that more than ever, an openness in the government channels for reflecting policy change, and decision-making seems to be happening more quickly. And I've been really heartened by that. An example would be instead of having youth age out of care in a pandemic, every province fell quickly into place to provide legislation that protects children and doesn't require them to leave their foster home or foster family to go into an uncertain future during a global pandemic. So I'm seeing an optimism. I feel some optimism about the future of our sector when things are really against us. I think that the spirit of our community will rise up to meet those most urgent challenges, and people can adapt and agencies can adapt to provide the most urgent services and supports required. The one thing that, if I have a moment, Steve, that I did want to mention that's been also very important in these past few months and has had a profound impact in my sector, and that is with the murder of George Floyd. It really put the child welfare system, in my mind, at the bullseye of the most urgent social issues of our time. It's been known for a very long time that Black and Indigenous children and families are disproportionately represented in the child welfare system. In Ontario, as an example, Black children represent 30% of kids in government care and only 4% of the general population. Over 50% of children involved in child welfare are Indigenous. So the racial and systemic discrimination issues and multi-generational impact of things like the residential school system have created a very inequitable system. And our foundation has not, been, like all the child welfare agencies, so aware of this. Yet, nothing has really changed in far too long. And so I'm certainly not saying that we have it figured out, but we see real action and I believe real change coming. In the months and years ahead to address those racial inequities.
Okay, great. Thank you, Valerie. We are now going to address our third and final topic before going to our question and answer session, and that's specifically the area of mergers in the not-for-profit sector. And I guess, Andrea, this is kind of your area of expertise. I know that Canadian Cancer Society went through a transformative merger with Canadian Breast Cancer Foundation, I guess about 4 years ago now, and more recently with Prostate Cancer Canada. So if you could spend a couple of minutes, given your experience, sharing your thoughts on the rationale for the mergers. Did the benefits that you were originally anticipating actually turn out to be the case? And do you think that mergers could be relevant for other charities and not-for-profit organizations?
Absolutely. I think this is a really good time to be considering mergers and other kinds of strategic alliances. But the Canadian Cancer Society has gone through several, going from a federated model of separate provinces into one national organization, as I know other large organizations are also on that path, and then merging with Breast Cancer Foundation and Prostate Cancer Canada. And the strategic rationale has there's been a lot of reasons to do it. Certainly financial pressures is one of them. Doing more with less, sort of in an environment of declining philanthropy, and has been a big motivator. And I think we've learned through our mergers that the benefits are real. So, we all hear this about the whole nonprofit sector, and we hear it about different elements of the sector that, from a donor perspective or an outsider perspective, why are there so many of you, and aren't you all doing the same thing, and can't you come together? And while that is an overly simplistic view of our sector many times, I think there is really some value in thinking about how do we combine, especially on the things like administration and fundraising that are costs that we all bear. So through our mergers, we've definitely seen that it's allowed us to reduce the administrative and reduce that duplication between administrative and fundraising costs. It's improved our mission metrics, so the amount that's going towards the mission has improved. Certainly, donors applaud it. It really makes sense to people, and it just resonates with people as a smart business decision. And it also gives you a scale and a kind of a market share that is helpful for just being visible and being able to be relevant to a large number of people. So if you were considering this right now, I would say a good place to start is to look at who else in your sector has, either similarities to you or is complementary to you. So the mergers that we have done in the last couple of years, I would say, are organizations that are very similar. We had really similar ways of working, like we're all funding research, support programs, and advocacy, and fundraising was underpinning all of it. So, that really lent itself to a lot of overlap and a lot of shared understanding of how to achieve our respective missions. But it's not easy. So definitely it takes a toll on staff and on volunteers who are, we're all passionate for our specific individual organizations, and that's essential for us to be successful in our work. You've got to love it. You've got to believe in it. And it is really hard to imagine how you might let that go for a higher purpose or for greater overall impact. And same thing for volunteers and the people who use your programs. It's also complicated systems wise because there's a lot of operational work that has to go on behind the scenes. And in leading into it, I would say just a couple comments. If you were to be contemplating going down this path, of course, your board plays a very big role, because the boards of directors ultimately will make this decision and are the stewards of our organizations. And I would say it's a multi-stage process. So if the two boards see that there could be value in exploring this, that sort of principle at the beginning to say that, yeah, we're going to look into this, that spirit of the vision has to be there. The openness and the vision and the champions for it need to be there. But then the next stage is really extensive due diligence to understand what you would really be getting into. So, both organizations have to be very open with all of their information, all of everything about them, your liabilities, your obligations, your contracts, everything has to be shared so that both parties can really understand that this makes sense, and we can see how will 1 + 1 = 3 in this scenario. So that process is, requires extensive work on both sides, and a real understanding of what are the non-negotiables, what are the deal breakers, the things that absolutely have to stay long into the future for this to work. Usually there's a size differential between the two organizations, and the smaller organization can't just be absorbed. There have to be the commitments to mission have to continue in different ways, perhaps, but they still have to be there so that ultimately this makes sense to the stakeholders of both organizations. So it's a process. I'd be happy to talk more with anyone who'd like to outside of this call. Be happy to share more of our lessons learned. I would say it's absolutely worth considering, and it has tremendous benefits. And short of a merger, there's also a lot of ways that we could do strategic alliances that I think could help us through right now. I know a lot of organizations are looking at things like, how could we share space? So, we could save money just by banding together in new ways through COVID that I know many people are considering right now, and that I think are beneficial to our sector.
Great. Thank you, Andrea, Ken, and Valerie. That was a terrific discussion. So it's about 2:50, just after 2:50 now. We've got around 10 minutes or so. We might go over a little bit for Q&A. So we do have a number of questions that have come in. And again, if you do have any, please feel free to ask them by clicking the icon at the top of your screen. So the first question I know is going to have application to all three of you, and that is, how are you dealing with donor fatigue? I guess, Ken, why don't we start with you, and Valerie and Andrea, if you want to jump in afterwards, that would be great.
Sure. I think the first thing that we're doing, Steve, is acknowledging it as real. And that's what I tried to say when I mentioned that we don't own the crisis. So not only does our cause not own it, but our sector doesn't own it. And as Andrea put it so well in the context of people living with cancer, everyone has their own experience, but everyone's experience has got a certain degree of stress to it. So we're, Steve, trying to make sure that we're in regular communication, that we're demonstrating impact, but that we're very intentional with the tone. We're extremely respectful of the fact that this is not business as usual. And we're in unfortunately, we're in a long-term game here. So we're not trying to do as much of the urgent appeal now or never, and instead talk about in the story of your life. If you didn't know the importance of having a quality, well-equipped hospital in your community, you do now. Be there for us so we can be there for you. But the tone of it is not aggressive. The tone of it, I hope, we certainly spend a lot of time trying to make it a respectful tone, a respectful conversation, because people have other considerations they didn't have 8 months ago, and we don't know what those are. So that's what we're doing about it.
Valerie or Andrea, do you have any other thoughts?
I would say, particularly with our largest major donors, the ones we've been really frequently in touch with and working with this year, I think there's a level of transparency as well that more so than ever, it's not like we weren't transparent before. I just mean more direct. I find that people really want to know what your challenges are in the organization, and also, how what you can do to be contributing, like testing those questions out and being very transparent about your challenges. I think that that has been resonating with a really large percentage in terms of our. Yeah, I agree with everything else Ken said about the broader context. It's and I've already said we're not perfect on our email communications, and that's been concerning us internally. And just being really clear, if we're one charity and we've sent out 10 messages in a month to the very same person, or think about that same person receiving that times the size of the sector. So we're trying to be a lot more thoughtful and a lot more organized about our communication planning with our mass communication work.
I agree with everything that's said. I guess on the flip side too, though, that there are a lot of people who still want to help. So I think as much as we have to be respectful and understanding that people are in many different kinds of challenging situations, I think it's still okay to ask, and it's still okay to be out there fundraising, and to not make too many assumptions about people being tired of you. I guess unless you're really hearing that from people, it's easy to feel a bit shy when you can see that there is hardship everywhere. It can hold you back from fundraising, and I don't think it should. We can't really let that happen to our organizations.
Fair comment. We have one specific question. Have any of you applied for the Canada Emergency Wage Subsidy?
Yes, we have, and we've found that to be a really helpful program. We've applied for it for all of the time that we're eligible, and certainly it's probably been the most helpful federal support that we have seen. For we haven't qualified for some of the other supports that have been available, but that one definitely has been helpful to us. Complicated to understand your eligibility and the changes, and we were finding that as the program was rolling out, we were kind of having to make our decisions about staffing and cutbacks. We were having to make those before there was clarity on what some of the federal support programs were going to look like. So that's been a challenge, but that program has been helpful.
I would just say that we early on we applied and tried to go for it, but it turned out we weren't eligible, in part because the beginning of our year was so strong. And we haven't made staff cuts or dramatic cuts to our programs. So in the end, we haven't been eligible for the ongoing program.
And we've been somewhere in the middle, which is that initially we weren't eligible, and in the summer things were a bit quieter, so we were eligible, and it has been a hugely helpful program for the sector, not just for we're fairly large shops, but for so many small shops with 1 or 2 employees, it's kept the lights on.
Okay, great. I think we have time for one more question, and I'm going to have each of you answer it, if you could. Knowing where you are now and where you started at the onset of COVID, is there anything you would have done differently? Now, this question came from the CEO of a large hospital foundation. So, Ken, why don't we start with you?
What would I have done differently? So I think if I could go back, I would pace differently. So it was so all hands on deck 24/7. It was just such an unprecedented, this is the big one. This is our time. I think our team worked incredibly hard. But I think that if I could do it a bit differently, Steve, I think I would pace it a bit. I think we were 4 months in before we started demanding that people take a day off. And people paid a bit of a price, I think, outside of work for that, and not unique, by the way, to us, people on the corporate side, the government side, the healthcare side. But as now it's become more clear that this is a long-term long-sum game, probably would have tried to pace things a little bit differently on the staff side. I'm actually very proud of how our team responded on the fundraising and tactical side. But I think maybe in hindsight, both for others and for self, I probably would have paced it differently.
Okay, great, Ken. Valerie?
Yeah, probably like many of you on the line, I ask myself as a CEO all the time, if we have such limited resources, so stretched for resources, and I ask myself if I could add one thing, what would it be? And of course, I have 19 things I'd like to add to our operating budget and to our plan each year. So if I could change one thing, I think I would, and it's something I plan to change going forward. It is to make that upfront investment in technology. And in the quality of our data, the technology, and the communication skill set that goes with all of that. I think that will pay us back the most in the long term, and it's probably one of the most challenging areas for us over these past 7 months. And I wish I'd kind of thought of that right at the very beginning, because the board was asking me, what do I need? So that would maybe be my hindsight. Okay,
thanks, Valerie. Andrea?
Oh, wow, those are really good. There's so many. I think the same thing as leaders, as I know so many people are on this call. It's really easy to look back and see so many things that I would have done differently, or I would have done in more consultation with more people. I think we have this large grassroots community of supporters across the whole country, and had we had a way to easily tap into all of them and ask for help with some of the solutions that we needed to come up with, in terms of especially changes to our some of our programs and how we were going to adjust our fundraising, I would have loved to been able to tap into that more easily. And that it kind of gets to maybe some of the technology investments that we also, if those had been in place, I feel like we could have had a big national dialogue about solutions rather than of course, we have that dialogue amongst our staff and our closest volunteers, but it would have been, I think, possible to rally even more input into all of our plans if we had had some of those systems available. And I really agree with the pacing too. It's now that we're in kind of this into the fall and people are tired and we know that we have to still keep going. it's really important that people get breaks, and so that's something that we're focused on going forward now.
Great. Well, as they say, hindsight is 20/20, but it sounds like all three of your organizations under your leadership have come through COVID quite well so far. So I guess I would say, Andrea, Valerie, and Ken, thank you very much for participating as guest speakers today. I think we got a lot of value hearing from your experiences, including some of the strategies and tactics that your organizations are implementing to deal with the pandemic. Hopefully, our audience members heard some ideas that they perhaps can use at their organizations. I did want to point out for everybody on the webcast that we are recording this session. You'll be able to access the recording for, I believe, 90 days. It probably will take us about a day to get it up and running, so ideally by the end of the day tomorrow. You can access it using the same link that was included in the original invitation. So if any of you think any of your colleagues or friends who weren't able to actually view this webcast live would be interested, please feel free to share the invitation and the link with them. And in addition to thanking our speakers today, our CIBC team would also like to thank all of you who work in the not-for-profit and charitable sector for all of the terrific work that you're doing to help us get through the pandemic. We recognize that this continues to be a really, really challenging time for many of you. So thank you for all of the great things that you're doing to help our communities get through this crisis. And we certainly hope that we return to kind of a more normal state of operations as quickly as possible. So in closing, our CIBC team is very grateful for the opportunity to be able to support our clients in the not-for-profit sector. If there's anything we can do to help your organization, please reach out to your CIBC relationship manager, and we'll do whatever we can to provide assistance. And on that note, it's 3:03, so we'll conclude this webcast. Thank you very much, everyone.